area just underneath her eye here. She has some black areas or depressions in this area which she feels are unpleasant. And we want to deposit some hyaluronic acid in that area. Now, most of the time, the hyaluronic acids are substances that are administered in the mid to deep dermis. Each dermal filler has an area where it works best. And the hyaluronic acids, or at least the one that I'm working with today, is meant to be deposited in the mid to deep dermis. However, in the tear trough area, that is not an area that accepts the mid to deep dermal filler well, because then it produces lumpiness. So we don't want to have that effect in her tear trough area. It doesn't produce a pleasing appearance. Instead of depositing this in the dermal layer, I'm going to place it just above the periosteum, or just above the bone underneath her eye, because this is what will lift up this skin. The skin is very thin in this area, and this way we'll be able to just lift the skin and give her the effect that she's looking for. The Restylane that I'm using today can cause a burning sensation as it's being injected. Therefore, I've already given Kelly a local anesthetic in the tear trough area, just a small amount of xylocaine. So I'm just going to turn her face just a bit. It gives me better access to the area, and as I said, I'm injecting this just above the periosteum in this area. It doesn't look quite as depressed as it was before I injected the local anesthetic, so you'll have to trust that this was an area that needed to be injected. And I'm going to go down. I can feel the bone underneath the needle. I'm going to go just along the edge of the bone so I know that I'm still in the same plane, and just give her a small dose. You can see it fill out just a bit. As we go along, steady pressure on the syringe. I'm just going to come around here just a little bit. Go down to bone. Across, just underneath the muscle. And I'm doing a technique that's called linear threading. That is, I'm depositing the Restylane as I withdraw the needle. There are two popular techniques to administering the dermal fillers. One is called the linear threading technique, where the injection is placed as the needle is withdrawn. The other technique, the push-along, is where the filler is injected prior to proceeding with the needle, where it actually opens up a plane in front of the needle and dissects along the tissue plane, and you can actually see it moving along the tissue plane as you move the needle forward. In the tear trough area here, I'm using the linear threading technique for Kelly. I'm just going to give her just a little bit more. There's a little area right there that I just want to hit right here. I'm going down to periosteum, underneath the muscle. Just going to give her a little bit more. You can see as I elevate the needle a little bit that it's in that area. Just a small amount more. Okay. I'm going to the other side. I'm just going to turn you just a bit. I'm trying to get you in just the right light here. Here we go again. You can see this dark area here, down to the periosteum, along the bone. Steady injection. So I think we've elevated this area just a bit. We didn't want to do a lot. We just wanted to see a little bit less of that dark trough, and I think we've achieved our goal here. This is a little bruising on this side, so that's why it looks a little bit darker. But I think you can see that we've actually elevated the tissue plane quite nicely here. She has a little bit of a dip here. Let me just go in here. one little shot. Okay. All right, so this is the tear trough area with the dermal filler. I've actually used Restylane, which is a mid to deep dermal filler, but in the tear trough area, I've actually placed the filler against the periosteum of the bone so that it does not lump or show in the tear trough area or the area under the eye at the orbital rim. I'm here with Kelly today. Kelly was treated approximately 2 weeks ago for some defects that she was concerned about in developing lines around her face and some aging defects that we wanted to correct. One of those areas was the tear trough area, where she actually had started to develop some darkening furrows, and I wanted to give her a little dermal filler to see if that would elevate that defect and give her a little bit of a youthful appearance. And as you can see, she really has a nice effect here where you can barely see any depression at all in the tear trough area. So we really elevated that area quite nicely. As I'm looking at Phyllis, I see that she has a little depression in her glabella region. This little depression probably has something to do with hypertrophy of the procerus muscle here. Normally I would want to administer some Botox to try to reduce the tension on this muscle to relax this depression. However, Phyllis does not want to use Botox, so what I'm going to try to do instead is to place some dermal filler in the mid to deep dermis to try to elevate this depression so that then she has a smooth contour across her forehead. She also has a few little lines here in the nasal bone, above the nasal bone, and I'm just going to fill that in just a bit too. This is a soft tissue filler, mid to deep dermis. This is Restylane, and it is a hyaluronic acid filler. So I'm just going to turn her head just a bit, and let me just, again, because I want to be careful about the placement, I'm just going to use a magnifier. Just turn your head just a bit. All right. Try to do this so you can see. She's been numbed with some topical anesthetic. I'm going to try to get right in the middle of this. Let's see. I'm just holding the skin so I can track through. You can see where I am on the level of the mid to deep dermis. You can see the contour of the needle there. I'm just going to put my finger back here to hold the skin taut. And I'm just slowly injecting. If I overcorrect this defect a bit, it doesn't bother me because I know I can smooth it out. The Restylane is very malleable. But as you can see, I've already eliminated quite a bit of the defect in the upper borders of it. I'm going to come from above to get the lower border. And you can see the level of the needle, and I think I'm a little bit superficial, so I'm going to come out and do this again. Just get a 4x4. Now sometimes as you inject, you'll get some erythema in the area, and that will obscure some of the correction. But you can see that we've got a nice elevation here. Yeah, it looks like a little shadow there from the erythema, but if you get close, you can see that it's actually pretty